A 52-year-old man with a history of alcoholism presents with loss of appetite, abdominal pain, and fever for the past 24 hours. He says he consumed 12 beers and a bottle of vodka two days ago. He reports a 19-year history of alcoholism. His blood pressure is 100 bar 70 millimeter mercury, pulse is 100 per minute, respirations are 20 per minute, and oxygen saturation is 99% on room air. Laboratory findings are significant for the following: sodium 137 milliequivalents per liter, potassium 3.4 milliequivalents per liter, ALT of 230, AST of 470. Which of the following histopathological findings would most likely be found on a liver biopsy of this patient? So, okay, yeah, once again, I think most of you got this right, which is great. So clearly, the first thing you kind of have to look at the end of this question, you kind of have to arrive at a diagnosis. Very obviously, this patient is having alcoholic hepatitis. Okay, I'm just going to say the few key points over here that point towards the diagnosis of alcoholic hepatitis. Firstly, okay, if you look at the symptoms that he's presenting with, okay, he is having a loss of appetite, abdominal pain, and fever. This is not very specific, it's kind of like generic. In addition to that, he's consumed 12 beers and a bottle of vodka 2 days ago. So he's had a binge drinking episode. So that should kind of point you towards a diagnosis or something related to, alcoholism. Moreover, okay, he is not having any hemodynamic instability. That is fine. His electrolytes are fine. Okay. So potassium is slightly lower, but that's only by 0.1. That's okay. The important thing you kind of have to look at is your ALT, AST level. Both of them are elevated, and you have to see the ratio. In this, very clearly, AST is greater than ALT. So anytime your ALT, AST ratio gets flipped, okay, that's your AST is greater than ALT and the ratio is more than 2, it points towards the diagnosis of alcoholic hepatitis. There is no doubt whatsoever, okay. So with that itself, you can just arrive at this diagnosis, okay. But the question is not asking about the diagnosis. They're asking about what we would to see, or rather what we would see if you were to take a liver biopsy from this patient. Okay, so the answer is E. Yes, it's cytoplasmic inclusion bodies with keratin, otherwise called your Mallory bodies or Mallory Denk bodies. Okay, that's pretty specific for alcoholic hepatitis. It's sort of the pathognomonic feature of that. Okay, so that is the right answer. Option A is a T lymphocyte infiltration. So usually alcoholic hepatitis, you will have an infiltration of neutrophils and macrophages, because it's an acute presentation, right? So we've already come across this, in any kind of acute inflammatory episode, you're going to have neutrophils, first coming in as your primary defenses. That's usually going to last for, up to 24 hours, following which macrophages are going to take over the phagocytic role. Okay. T lymphocytes are going to come only much later, kind of like your secondary response along with your plasma cells. So since it's an acute presentation, you're not going to get T lymphocytes immediately. Okay. Option B, macronodular cirrhosis. I think a couple of you actually chose this. Just note that in alcoholism leading to cirrhosis, you're going to get micronodular cirrhosis and not macronodular. Macronodular is what you normally see in the case of viral hepatitis, okay, not in the case of alcoholic. So alcoholic, always think only of micronodular cirrhosis, okay. Option C is positive periodic acid shift stain. This is usually seen in patients having alpha-1 antitrypsin deficiency who can present with emphysema as well as cirrhosis. Okay, I'm not going to go too much into what the thing is. You already know it's a genetic disorder. Okay, there's an enzyme deficiency that normally inhibits your neutrophil elastase, so because of that causes damage. Okay, so positive PAS staining is going to be seen in individuals with that deficiency. In this case, it doesn't have anything to do with that because they've not mentioned anything about any pulmonary disorder, and they've not mentioned anything about, your alpha-1 antitrypsin levels anyways. So you can just rule it out. Periportal necrosis. Okay, so once again, like I mentioned, very similar to macronodular cirrhosis. Just know in the case of alcoholic cirrhosis or the stage just prior to cirrhosis, okay, you're going to have a central lobar necrosis. Okay, you're not going to have periportal necrosis. This is seen in other conditions, like I think it's given in first aid, like each of the 3 zones, what is affecting, like in certain things it's like the virus, in certain things is the toxin. So you can just go through that and like figure out which one affects what. But it is important to know which zone is affecting what and what kind of necrosis you get. Okay, so central lobular necrosis is what you get in the case of alcoholism. So since in this case I've mentioned periportal, you can just very easily rule it out.
Thanks for watching. Please give a thumbs up and subscribe for more.